Hello friends, let us now learn some important points about in the splenic lesions. Let us now learn about the nodular splenic lesions. So, in the nodular splenic lesions, that means we have spleen, and in the spleen, if there are lesions which appear to be nodules like, then we call it as nodular splenic lesions. These nodular splenic lesions can be divided into two types. One, we have micronodular splenic lesion. Second, we have macronodular splenic lesion or nodular. Actually, micronodular splenic lesion and nodular splenic lesion. Micronodular splenic lesion are the nodules. If the nodules are less than 1 centimeter, then we call it as micronodular splenic lesion. And if the nodules are 1 to 3 centimeters, then we call it as nodular splenic lesions. Now, what are the differential diagnosis of nodular splenic lesions? Nodular splenic lesions can occur due to infections, certain infections or causes of nodular splenic lesions. Nodular splenic lesions can occur due to infections, like some of the infections like mycobacterial tuberculosis, that is mycobacteria, or histoplasmosis. Patients with histoplasmosis can also present with nodular splenic lesions. Then we have sarcoidosis. Patients with sarcoidosis or some patients who present with malignancy. In malignancy also, there can be associated with nodular splenic lesions. Malignancies like, for example, if a patient suffers from lymphoma or if the patient has any metastatic disease, in these conditions, there is a chance that the nodules are seen in the spleen. These are common causes, whereas one of the less common causes of the nodules seen in spleen include, we have gamma Gandhi bodies which are seen in the spleen as nodules. Similarly, we also have we have gamma Gandhi bodies which are seen in the spleen, which are also nodular disease, and we also have Pneumocystis jirovecii. Pneumocystis jirovecii, which is a parasitic infection, or we can say it is a type of fungal or between fungus and parasite. So this Pneumocystis jirovecii also can present has or can have involvement of splenic nodules. And in cat scratch disease, which is caused by Bartonella, in that also we can have splenic nodules. So if the patient has splenic nodules, always you should ask the history of the patient. Why? Because if the patient is already diagnosed with a certain disease, like if the patient is either diagnosed with tuberculosis, or if the patient is diagnosed with sarcoidosis, or if the patient has some lymphoma, then there is a chance that he can have nodules in the spleen. Okay. So this is one thing. So taking history in this case is very, very important. Next, the next important thing is we have to see how these nodules look for each of the diseases which we have discussed till now. So the nodules can be actually, they can be either hypoechoic, or they can be hyperechoic also. The nodules can be hypoechoic, they can be hyperechoic, they can be smaller, which is micronodules, or they can be very big, which is macronodules. So based on our differential diagnosis, we will see each of the diseases in detail. Thank you.